Good evening. Thank you for joining us for Lupus Canada's Disease Awareness Webinar. Tonight, Fonda Betts and Tanya Adams will be discussing the benefits of cannabis use for lupus. Ms. Betts is the founder and CEO of Greenleaf Medical Clinic. Fonda's extensive knowledge of cannabis comes from studying cannabinoids, and I hope I'm saying that correctly, in clinical practice from the University of Toronto Faculty of Medicine, patient assessments, and collaboration with cannabis physicians and industry leaders. She has assessed and developed customized treatment plans for more than 15,000 patients. Her work and dedication have gained her recognition as a leader in cannabinoids. Tanya Adams has extensive experience as a patient care coordinator and over 5 years as a cannabis educator and dosing expert. Ms. Adams' primary focus is on creating exceptional client outcomes. She collaborates with industry leaders to ensure the voice of the patients and adult consumers is being heard with respect to routes of administration, product selection, and ongoing supply. She also educates healthcare professionals on the safe use of cannabis. Before I hand this over to Ariana Ranjbar, who is our moderator for this evening, I have a few housekeeping items to address. Please note that all attendees are placed in listen-only mode and with both video and audio being disabled. Should you have a question, please post it in the chat box and we'll do our best to address those at the end of the presentation. We hope you find this webinar informative. I'll now pass this over to Ariana, who is our moderator for this evening. Ariana?
Thank you, Leanne. Yes, so just to reiterate, I will be the moderator. So if you have any questions throughout the webinar, please feel free to put it in the chat box. And if it's urgent, I will address it right away. If not, then we'll wait till the Q&A at the very end. And thank you both so much for joining us tonight.
Great, thank you, Ariana. So I'm going to share my screen. My name is Fonda. I'm here with Tanya. We're your co-presenters. So first off, I want to say thank you to Leanne for hosting Tanya and I today to talk about cannabis and lupus. And also to Ariana for working behind the scenes and helping us with our slides and putting everything together. So Leanne did do a introduction with Tanya and I, but just to reiterate, so I'm what we call a master cannabinologist, which is somebody who really understands how the human endocannabinoid system works and how it interacts with cannabinoids from the cannabis plant. I founded the Greenleaf Medical Clinic over 10 years ago. Since then, I've been doing patient assessments, as well as training physicians in the clinic, working directly with our medical director. Greenleaf is also a UBC teaching clinic, so quite often we'll also train other healthcare professionals as well. And then Tanya, she's great, she's amazing. She's the Greenleaf office manager, as well as our senior cannabis educator. And she works directly with our physicians and then as well with our patients creating their cannabis treatment plans. So we'll get started with some information on the endocannabinoid system and how cannabis interacts with the endocannabinoid system. So for those of you who have never heard of the endocannabinoid system, it's short for ECS. And this is a system of pathways of receptors within the human body. They're really abundant in our organ system. So we have two cannabis receptors, CB1 and CB2. So you can see from this slide that we have more CB1 receptors than we have the CB2 receptors. So think of the CB1 receptors primarily as being in the brain and the central nervous system. For people who are curious as to, is cannabis safe? Can I die from cannabis? The answer to that is because we don't have a large concentration of cannabis receptors in our brainstem, in the regions that control our respiratory and our cardiac function, it makes cannabis a very safe medication, specifically THC. For those of you who have heard of people who've had an opioid overdose, for example, that can happen because we have a large concentration of opioid receptors in the base of our brainstem. And for a fatal overdose to happen, the patient or the person would take too much of an opioid, which can cause respiratory depression, which can lead to the brain telling you to stop breathing. Because we have a low concentration of these cannabis receptors in our brainstem, the risk of overdose is virtually impossible. Health Canada on their website has extrapolated data from rodent studies where it found that for an adult to have a fatal overdose, they would have to consume 75,000 milligrams of oral cannabis with an approximate THC value of about 20%. That is way more than a heavy user would use in a day. So cannabis, specifically THC, can be a very safe medication if it's taken as intended. Not to say that if you drive impaired, you can't get into a car accident and have a fatal crash. So definitely don't drive if you're on THC and feeling any sense of impairment. But if it's taken as intended, it can be a very safe medication. And then the CB2 receptors, we have these to a lesser extent. So think of the CB2 receptors primarily being in the peripheral organs and in the immune system. So what is a peripheral organ? So think of skin, for example, as a peripheral organ, bones, what else? Pancreas, spleen. So we do have the CB2 receptors in there as well. And then there are some crossovers with the CB1 and the CB2 receptors. So when we're taking cannabis-based products, the cannabinoids from the cannabis plant interact with the cannabis receptors, the CB1 and the CB2 receptors. So in Canada, we have a program for medical patients called the Access to Cannabis for Medical Purpose Regulations, whereas Health Canada has approved hundreds of companies to cultivate and sell cannabis directly to patients and also to the adult consumer market through dispensaries. And what they're really interested in is cultivating female plants. And they want the female plants because they want to harvest the cannabis flowers or the cannabis bud. So in the middle of this slide is a picture of a cannabis bud. If you were to zoom in, so this is zoomed in at 100 times, this trichome picture, you would see what we call trichomes. And within the trichomes is where all the magic happens. So we have terpenes, flavonoids, also cannabinoids. So what are terpenes? So think of terpenes as the essential oils in the cannabis flower. So if you've ever smelled like a cannabis bud, maybe it has a scent like lemon, for example. So that can be from the terpene called limonene. Or maybe it smells like lavender. So that can be from the terpene called linalool. Another popular one is pinene. So that comes from pine. So if you've ever gone for a walk in nature or on a hike, and after that hike or that walk, you feel like naturally relaxed, well, that can be from the terpene called pinene, which you smell in the air. Another popular terpene is called myrcene. So myrcene is also found in hops, so beer, for example. Myrcene in animal studies has shown to be sedating and also help with pain. So when you're drinking those beers at night and you're feeling tired and lethargic, well, that could be from the terpene called myrcene. Then we also have flavonoids. So what are flavonoids? So think of flavonoids as phytonutrients, so phyto meaning plant. There have been over 8,000 different flavonoids have been identified in other fruits and vegetables. There are approximately 20 flavonoids that have been identified in the cannabis plant. Quercetin is one of the main flavonoids found in fruits and vegetables, but also found in cannabis. But there are 3 specific flavonoids found in cannabis, cannaflavin A, B, and C. Most of the research has been done around cannaflavin A, more for its anti-inflammatory properties. And then we also have cannabinoids. So what are those? So THC and CBD, which most of you have heard of. So CBD is short for cannabidiol, and THC is short for tetrahydrocannabinol. Even though there are more than 2 cannabinoids, there have been more than 150 different cannabinoids have been identified. We're going to talk only today about CBD and THC because these are the 2 cannabinoids that have been mandated by Health Canada, where the licensed producers have to test them for their cannabinoid profile and also for any microbial or chemical contaminant levels. So the main takeaway here is that when we're using cannabis-based products, whether we're inhaling them or ingesting them, that those cannabinoids interact with the human endocannabinoid system within the human body, specifically the CB1 and the CB2 receptors. And then a little bit about the differences between THC and CBD. So when we're talking about these two main cannabinoids, people ask, well, what are the main distinctions between these two? So when we're working in clinic, we like to recommend a CBD-based product that is from a non-hemp plant. So the main distinction between a CBD hemp plant and a non-hemp plant is that CBD from hemp is going to have less than 0.3% THC. CBD from a non-hemp cannabis plant is going to have greater than 0.3. So usually the ratio that we like to work with patients is a CBD product that's around a ratio of 20:1. So 20 part CBD to 1 part THC. So why is that important? Well, in the previous slide, I showed you the slide of the plant compounds, so the terpenes, the flavonoids, and the cannabinoids. There has been a physician, or there is a physician by the name of Dr. Ethan Russo, who has written several scholarly publications on what we call the entourage effect. So the entourage effect is where the sum of the cannabinoids, the flavonoids, and the terpenes equal the potential for a wider range of therapeutic benefits. So it is for that reason that we like to recommend a CBD product that is a full spectrum so that you can have the entourage effect compared to an isolated cannabinoid, which is usually found in a hemp plant. But the main distinctions between CBD and THC is CBD is used more for inflammation. So patients who have inflammatory pain, it can also be used as an antipsychotic, also as an anti-seizure medication. Science is also showing it as a neuroprotectant. So as we age, our nerve endings start to break down. So it helps rebuild those nerve endings. And then both of them together can work as a pain reliever, which we call an analgesic, as well as they can work with patients who experience nausea and vomiting, as well as they can both have anti-anxiety properties. THC works more with patients who suffer with spasticity, really deep nerve pain, also can work as an appetite stimulant, muscle relaxant, very, very good for sleep. So we don't actually recommend CBD to our patients for sleep. And the reason why that is because even though THC is psychoactive, CBD is not psychoactive, but we know that CBD does have an impact on the brain. And so for that reason, our patients have reported when we have authorized CBD for sleep that their bodies are tired, but their brain is still on that hamster wheel. So we like to recommend CBD use taken in the daytime. And then for nighttime, we like to recommend THC for sleep. So for those of you who have never tried THC, I really want to stress, don't be afraid of THC. The high that can be associated with THC or the impairment is really dose dependent. And when we're working with patients in clinic, we like to focus our dosing at subperceptual levels, which is before the impairment would happen. So just to keep that in mind, nighttime is a very good place to start with THC. And the reason why that is because if there is any chance of impairment, then the idea is that you would be asleep, so you wouldn't necessarily feel it. And then with the Health Canada licensed producers, they also have on their websites these different types of classifications for the cannabis plants. Sativa, indica, and hybrid. So this is more of the plant morphology. So sativa plants, for example, they grow taller, a little bit more spindly compared to their indica counterpart. Traditionally, sativa dominant strains are used for the daytime. Indica dominant strains are used for the nighttime. And then hybrids are kind of a cross between sativa and indica. Some of them are balanced, meaning they're 50% sativa, 50% indica, but some of them may have more sativa and some of them may have more indica. We find that cannabis really can be a bit of a complicated process for patients because it's not a one size fits all, and what works for one patient doesn't necessarily work for the other. So an example, if somebody has anxiety, for example, we wouldn't necessarily recommend a sativa dominant strain for that patient, only because we wouldn't want to make their anxiety worse. So we would potentially recommend an indica dominant strain or a hybrid, because indicas are really calming to the central nervous system. So just to point these out, because as you start navigating the Health Canada licensed producer websites, and even on the dispensary website, you'll start seeing these classifications of sativa indica hybrid. I personally feel that these are very old school ways of classifying these plants, and that we're learning, and we'll learn more through research, that the therapeutic benefits are starting to show that they're coming from the actual terpenes that are found in the plant. Also with the cannabis plants, there is different spectrums. So when these Health Canada licensed producers cultivate their plants and they have their cannabis flower, it all starts out as full spectrum. So cannabis flower is full spectrum, meaning it has the terpenes, the flavonoids, and the cannabinoids. That's excellent for patients because of the entourage effect. Reminding you that the entourage effect is the potential therapeutic benefits are increased when you're using full spectrum products because you're getting the terpenes, the flavonoids, and the cannabinoids. Broad spectrum products are products that don't have any THC. So what these licensed producers do is they cultivate these female cannabis plants, then they create byproducts. And with these byproducts, maybe they're taking out all of the THC or they're leaving in a little bit, which we classified as hemp. And then we also have what we call isolated cannabinoids. So some of the licensed producers are starting to extract single molecule cannabinoids from the plants. An example of that is CBD isolate, THC isolate. There's also other cannabinoids that they're starting to isolate from the cannabis plant as well, such as CBN and also CBG, which we don't talk about here. But the main takeaway from this slide is, as you start looking for these cannabis products, really look for, are they full spectrum, are they broad spectrum, or are they isolate? And it can be very confusing, so you want to make sure that you're reading the cannabis label correctly. So within the cannabis products, we look at these medical appropriate products more as being oils, soft gel, sprays, kin slips, which Tanya will talk about more, also topicals. And then the adult consumer market, which are products more suited for the recreational users, are things like the cookies, the teas, the baked goods. When we're working with patients in clinic, we don't recommend the adult consumer products, only because it's very challenging to dose those products. The medical appropriate products are ones where we can kind of work more on standardized dosing protocols. So Tanya will talk about these in the next few slides. And so in this section, we're going to talk about cannabinoids in clinical practice. And this is really, what do doctors look for? What are the guidelines that doctors have to follow? Doctors in BC follow the College of Physician guidelines. And we really look at the summary of evidence for cannabis and cannabinoid efficacy. And I know, looking at this slide, you're all thinking, oh my God, there's nothing about lupus on here. And so just to really stress that even though there's nothing specific to lupus on here, it's really hard to find any reputable studies on lupus. I found there is one clinical trial that is currently going on using a synthetic non-psychoactive cannabinoid, which I'm assuming would be CBD, where they're working on a clinical trial to test it for the anti-inflammatory properties. And so this is what we have today. And so most of the moderate to substantial quality evidence is around chronic pain or neuropathic pain. So neuropathic pain is that deep nerve pain, as well as for chemotherapy-induced nausea and vomiting, helping patients with spasticity, also seizure control, which can also be challenging for some lupus patients. There's some limited evidence, so don't be so concerned if you have some of the symptoms on the limited evidence side, because I can tell you, with working within Greenleaf for the last 10 years, anxiety disorders, for example, we find that patients, whether they're using CBD with a little bit of THC added, have very good positive outcomes with anxiety. We know that THC does work very well for patients who have a hard time sleeping. Limited evidence for cancers. So one thing with regards to cancer is any cancer, any disease, any condition, really what we do in clinic is we work on the symptoms. So we can never say that cannabis is a cure for any disease or any condition because there isn't enough evidence to support that. And cannabis itself does not currently have what we call a DIN number, which is a drug identification number. So even though you can get medical cannabis, it's not technically approved as a medication. There are some synthetic cannabinoids, such as nabilone, for example, which is an isolated THC product, which does have a DIN number and is available by prescription from your doctor. However, it is an isolated cannabinoid, and we've had patients who have switched over from nabilone, for example, and have gone on full spectrum products and have had much better outcomes than on nabilone. And then as well as anything with the GI tract, and that really is dependent on the route of administration, whether they're taking oral preparations or inhaled cannabis. But patients do have very good positive outcomes for anything really involving the GI tract. Also symptoms associated with ALS, motor disorders. And then for people who are addicted to other addictive substances, there is limited evidence. However, we found in clinic that CBD and or THC does help those people as well. And then for people who have schizophrenia, bipolar, THC may not work best as a first, or may not work best at all, and we would look at CBD. And just to also mention that cannabis is also not a first line treatment for any disease or any condition. So what that means is that usually patients will have tried other medications to see if that worked for their symptom or their condition. And then if they failed that treatment, then they would consider cannabis. And so who should use THC with caution? So this document was written by the College of Family Physicians. It is with regards to smoking cannabis. And as Tanya will explain, we don't recommend smoking cannabis to any of our patients just because there is a risk to smoking. So we recommend a process called vaporization, which is a way cleaner way to inhale cannabis, which Tanya will get into. So the recommendation is that THC is not authorized to people under the age of 25. So why is that? Well, that's because our brains aren't fully developed until we're 25. This can be really confusing because in BC, the adult age for purchasing cannabis from a local dispensary is 19. So not to say that the doctor would not authorize you THC, but the doctor may recommend that you try CBD first and then see if you could add in THC a little bit later. Also, if you have a personal history or a strong family history of psychosis. So again, cannabis is not a one size fits all. Everybody is an individual. Most likely your healthcare practitioner would do a deeper dive to make sure that you were appropriate for THC. And then also the other recommendation is that if you have a current or past cannabis use disorder, THC should not be recommended. So this is with regards to a cannabis addiction. I've had Greenleaf for 10 years, and the 10 years there, I've never met any patient who's had a cannabis addiction. So we do see this more in the adult use cannabis market where they're using much higher doses of THC compared to the medical market. Also, if you have an active substance use disorder, well, what about harm reduction? Because obviously cannabis is safer than heroin, so we're kind of a little bit mixed there. Also, if you have cardiovascular disease, so the main takeaway here is unstable cardiac disease. So if you have unstable cardiac disease, then THC would not be appropriate. However, if your cardiac disease is stable, then chances are THC may be appropriate for you. Also, if you have respiratory disease, so the concern here is smoking. And Tanya's going to talk about vaporization, which is a much better, safer way to use inhaled cannabis. Also, if you're pregnant, planning to become pregnant or breastfeeding, you should use caution with THC. And that again is because of the developing fetus. And then a little bit about potential drug interactions. So these are potential drug interactions. And I stress the word potential because in clinic, really significant drug interactions are unlikely. Well, why is that? Well, it's because we start low and we go slow. The main one that really pops out is the central nervous system depressants. So you want to be more cautious with these. So when you think of a central nervous system depressant, what does that do? So that slows down the brain, also relieves people of pain. It gives them a little bit more of a calmer feeling. So THC can also be a central nervous system depressant. So some of the things that can happen, which is not a true drug-drug interaction, is you can experience what we call the additive effect. So the additive effect can come from combining medications. So cannabis has a very unique way that it can be used with other medications. And so we call it co-using. So if patients are going to co-use cannabis with other medications, so we'll use sleep, for example. So sleep, so say, for example, your doctor has prescribed you Zopiclone for sleep. So you're on Zopiclone, you're still not sleeping well. Your doctor doesn't want to increase your Zopiclone, so says to you, well, why don't you try THC? So you will try THC with your Zopiclone. At some point, you're going to have what we call the additive effect. And you'll know when that happens because it may present itself the following day. You feel a little bit more sluggish than you normally do. You have a little bit more fatigue, or maybe you wake up in the middle of the night, you feel a little bit more unsteady on your feet than you normally would. And that could be caused from the additive effect. So that's the Zopiclone plus your THC is causing that additive effect. So when that happens, you want to reduce your THC to your previous well-tolerated dose, and then make an appointment with the doctor that prescribed your Zopiclone if you're wanting to decrease it, and ask them to consider doing a slow taper, which is a reduction plan of your Zopiclone. If you don't want to reduce the amount of Zopiclone, well, then your sleep is going to be as good as it's going to get, because every time you have a dose increase of THC, you're going to continue to experience that additive effect. Also, the additive effect can present itself with alcohol. So, it's okay to have a cocktail or two, but just be aware that you could experience the additive effect with alcohol. And then the other thing about medications is that the reason why drug interactions happen is because the majority of medicines and cannabis are processed by the liver. So we have to swallow them. So anything we take by mouth, we have to digest. That gets processed, it goes into our liver, and then from our liver into our bloodstream. So the reason why drug interactions happen is because in our liver, we have liver enzymes. And with some medications, the liver enzymes start competing with each other. So what can happen is you can have increased blood concentration levels of either the pharmaceutical medication or either of your cannabis-based medicine. So if any of your prescription drugs have the potential to do that, then your doctor may say, it's best for you to take your cannabis-based medicines 2 hours before or 2 hours after your certain pharmaceutical medication. So definitely talk to the doctor if you see any of your medications on this list. Also, we don't do any dose adjustments for patients who have kidney disease. And the reason why that is because cannabis is processed by the liver and not by the kidneys. Also, for those with liver disease, some of the evidence is pro, some of it is not. And so the best thing that we could say here about liver disease is that prior to you starting your cannabis treatment, it's recommended for you to talk to your doctor to see if they can do what they call a liver enzyme test, so that they have a baseline so that they know what your liver enzyme levels are, and then potentially do a trial of cannabis-based medicines so that they can have a comparison. When you see your doctor and follow up in 1 to 3 months, they can look to see if your liver enzymes have improved or not. And then a little bit about the key points on cannabis. So, contrary to a lot of the information online, we really want to stress that cannabis is not a one-size-fits-all. It's not a magic bullet. And that when we're using it in clinic, we're not using it to cure any disease or any condition, that we're using it to help patients manage their symptoms better so that they can have a better quality of life. Some patients continue on their normal course of medications. Some other patients are adamant about reducing other medications as well. And so when and if you do decide to reduce other medications, just know that it's one medication at a time, and you don't reduce medications during cannabis initiation. And the reason why that is because if you start cannabis and then also start reducing medications, if you have side effects, your healthcare practitioner can't tell if those side effects are coming from reducing the other medications or if they're coming from your cannabis-based medicines. So when we're looking at patient symptoms, we try to really identify what are the top 3 symptoms. So these are some of the more common symptoms that I found on lupus from the Lupus Canada website. You know, it's not that much different from patients with other chronic inflammatory diseases, but we find that patients tend to have symptom clusters. So usually it comes in packages of 3. So an example of that would be if you have lupus and you're suffering from chronic pain, then because you have chronic pain, you may have a hard time sleeping. And then because you have a hard time sleeping, you may also have some severe fatigue in the day or some anxiety and or some depression. So we like to focus on the top 3 symptoms, not to say you can't have more than 3 symptoms, but because cannabis is abundant because the cannabis receptors are abundant in the majority of our organ systems, if you have more than 3 symptoms, the secondary symptoms will naturally go away. And so we call this multimodal, which is why doctors like cannabis-based medicines, because you can have one prescription cannabis, such as CBD, for example, and it's going to help with pain, it's going to help with inflammation, it can also help with anxiety, and it can also help with fatigue. So that's one great thing about cannabis, but just a reminder that we're focusing on the symptoms, and so we don't focus on the disease or the condition, because we can never say that cannabis cures any of that. And so when your healthcare practitioner is doing your treatment plan, it's really important that they assess the type of symptoms you're having. So are your symptoms acute? So acute symptoms are symptoms that come on suddenly or they're not all the time. So for acute symptoms, we like to recommend inhaled product, which Tanya will talk about later. And the reason why that is because inhaled cannabis is very fast acting, but it's short acting. So it's not going to last for a long period of time. And then for chronic or persistent symptoms, so these are all the time, we like to recommend ingestion. So it's a product taken by mouth and swallowed, and it's metabolized by the liver. So the onset of action is anywhere from 1 to 2 hours. But the great thing about it is it's going to stay in your system for 6 to 8 hours. So it's going to give you that long acting relief. Then we also look at your pathophysiology of your condition. So if it's inflammatory in nature, which lupus is, then CBD would be a good starting place. If you have some neurological symptoms as well, we might consider adding in some THC. And then we also have some exceptions. So children, seizures, psychosis, bipolar, we like to stick with CBD products. Even though we're not recommending hemp-based CBD, we find that these patient populations can tolerate the CBD very well. And then they also look at, when do your symptoms occur? Daytime? Are they nighttime? If they're daytime, CBD is a really good place to start. When the doctor sees you in follow-up, which should be usually within 1 to 3 months, if your symptoms aren't well controlled, then maybe they want to increase your dose or add in a little bit more THC. And then also for nighttime, sleep is a great time to use THC if you don't have any contraindications to THC. And your doctor may look for a product that has a myrcene content that will also help you with sleep. Also, just a reminder that you can take cannabis with other medications, but just to be very mindful of the additive effect. And so now in this section, Tanya's going to talk about the methods of use, monitoring, and any potential side effects. So I'm going to drop my slide, but I just want to bring your attention to the document in the top right-hand corner. And maybe Tanya can put the link in the chat box at some point. Okay. So this document is titled Practical Considerations in Medical Cannabis Administration and Dosing. And it was written by Dr. Caroline McCallum, who is the Greenleaf Medical Director, as well as Dr. Ethan Russo, who's written several scholarly publications on the entourage effect. And it's a really good document to practical considerations in medical cannabis administration and dosing. And it really does do a deeper dive into what we can, talk about in this 1 hour together. There is some doctor language in there. However, I think most of you would be able to figure it out. If your doctor is hesitant about authorizing cannabis, or they're not sure where to start with dosing, this is a really good guideline for them. Also, they can go onto the Health Canada website. There's information there for healthcare professionals as well. So I'm going to drop my slides so Tanya can talk about these.
Perfect. Thank you, Fonda. Great.
I love that little sunshine I have.
I know. I was like, ooh, it looks like
angels in the house, right?
Like an angel wing almost. So yeah, so we're going to talk about, I would say, medical methods of use. So as Fonda mentioned, so we'll start with inhaled cannabis. And as Fonda mentioned, we do not recommend smoking cannabis. And so when we say light up a joint, for example. So smoking cannabis would include joints, bongs, and pipes. So if you were to light up a joint with a lighter, the heat from that lighter is too high of a heat. And so in turn, we're burning and combusting the product, and then we're inhaling all those carcinogens and tars and ash. So not very healthy. Another sort of interesting fact is that when we light up that joint with that lighter, because that heat is so hot, we're actually destroying over half the medical compounds Fonda spoke of earlier. So there goes the majority of all those beautiful terpenes, flavonoids, and other cannabinoids within that dried flower. So you're really, destroying medication, and you're not going to get a true therapeutic dose. So we're not going to dive too deep into vaporization, but I like to give an example for anyone out there who wants to learn more on inhaled cannabis. We do offer a full webinar on that, and that comes in September. So you could always go ahead and register on our website. But this is one example of a dried cannabis vaporizer. They come in many shapes and sizes and price points, but basically you would take your dried flower, loosely grind it up, you would put it into the oven, which is located on the bottom of this device, turn it on, and it'll heat up. And so here you'll see there's 4 little lit up circles. Each one represents a temperature. So now you are in control of making sure that your temperature is under combustion. So what is inhaled cannabis good for in the medical arena? Well, actually, inhaled cannabis is very good for acute symptoms. So symptoms that come on suddenly but don't last a long length of time. So a good example would be like a headache. So when we take our inhalation, it goes directly into our lungs and almost instantaneously is released into the bloodstream. So the onset is very short. You're going to feel it take effect within seconds to minutes. The peak of that medication usually sits at around the 1 hour mark, and then it'll slowly dial down, giving patients anywhere, I would say, between 3 and 4 hours of symptom relief. So that's inhalation. Now, I feel, and I'm sure Fonda would agree, in the medical arena, oral administration is probably the most popular. And so that'll include everything from tablets to dissolve strips to oral mucosal sprays, as well as what we call the bulk oil. Now, if you're new to cannabis, you will most likely be started on a bulk oil because the other options, the tablets and dissolved strips and such, are dosed at a higher level than time where we would start patients. So you would get a loose oil with a really nice pediatric syringe, which will just ensure that titration is very easy for the patient. So when we're using an oral product, it's best suited for chronic symptoms or symptoms that are very persistent. So if you have a lot of joint swelling, normally that's, 24 hours a day. So when we take the oil products, we're dropping them into the mouth, having a sip of water. That oil has to go through our whole system to the GI tract. GI tract digests it, moves it to the liver. Liver metabolizes, releases it out into the bloodstream. So that can take anywhere from 30 minutes to 2 hours for the onset of that medication, depending on how fast you metabolize the oil. Now, the peak of the medication typically sits at about the 4-hour mark, and then slowly dialing down, giving patients anywhere from 6 to 8 hours of symptom relief. So a nice length of time there. Now, over the last year or so, the cannabis topicals have become very, very popular. These will come in a couple different blends. You can get THC on its own, CBD on its own, and then what we call in the industry a balance. So equal parts, both CBD and THC. Now, when we're using a topical, it's binding to those wonderful CB2 receptors Fonda spoke of. And so it's not breaking the blood-brain barrier and entering the bloodstream. So it should not be causing impairment. However, if you do have open rashes or wounds, we would recommend that you stick to a CBD topical, because if we did get a little bit of THC topical into that open rash or that open wound, there is easier access for it to enter the bloodstream, and it could cause potential impairment, okay? So the topicals work very, very quickly. Patients say that they can feel their localized pain area dull down or numb out within 3 to 5 minutes, and it's giving them symptom relief for up to 4 hours. So we will see patients use an oral product in conjunction with the topical a lot of times. So they're using this in between dosing. And then a new product to the industry is suppositories. They are brand new. Suppositories would be used either vaginally or rectally. They're great for chronic symptoms or symptoms that persist, but they have a faster onset of about 15 to 20 minutes, but still a long duration. So patients are reporting anywhere between 8 and 12 hours of symptom relief. So a lot of different options out there for everyone. So once we start our cannabis treatment, or maybe you've been using cannabis for quite some time and your physician has now introduced a new cannabis product, we highly encourage everyone to monitor. And how do we monitor? Well, Fonda has done up this fabulous dosing journal that a lot of our patients really love. So you're more than welcome to visit our website and print off a few copies and make it into a book. Or there's a lot of free cannabis monitoring apps in the App Store. So you can take your pick of which way is best for you. And what are we monitoring for? Your physician is going to want to know your current dose, your current frequency. So how often are you taking your cannabis? How long is it taking to take effect? How long are you getting symptom relief? What has improved? And then, of course, any side effect. And we highly encourage patients to follow up with their physician once every 3 to 6 months for possible treatment plan adjustments. But we would actually encourage you to follow up, maybe even if you could, every 6 weeks, just until you're stabilized on the cannabis. And so here we like to go over some acute adverse effects or acute side effects. So remember, acute side effects, or acute means short term. So these will not last a long duration. These side effects are usually very tolerable for most people, and they're really not unlike any other side effect you would see with like a pharmaceutical or another medication. So here you'll see the common. It wouldn't be, it's not uncommon when we start a new medication for our body to take a day or two to adjust. So if you wake up the first night to use the washroom when you use a nighttime oil and there's a mild dizziness, that'll go away within a couple days. If you use your CBD during the day and you felt slightly fatigued, again, that'll go away in a couple days. The rare side effects, those would include things like vomiting, heart palpitations, paranoia. We actually don't see that typically in clinic, as we are using small dosing with slow titration. So the patient's always going to meet or reach their optimal dose, the dose that gives them the most relief with the least amount of side effect, way before they'd ever hit any of these rare side effects. You see those more in the adult use market where people are experimenting with products and taking, too high of a dose. And so just a couple things to look out for in terms of route specific. So diarrhea or loose stool can come about time to time for certain patients as they get higher up in doses of CBD. Just remember, this is not caused by the cannabis itself. This is caused by the base oil. And the majority of producers are using an MCT base. And so MCT oil is a fancy term for refined coconut or palm kernel oil. So if you have an adverse reaction or you don't like those types of oil, talk about it with your prescribing cannabis physician. They can go over some other options. And of course, the cough, phlegm, and bronchitis, again, from smoking cannabis. So please go out and purchase a vaporizer, and then we won't have that side effect. But what do we do if we do experience a little mild side effect or a moderate side effect? I always say, remember Fonda's voice at the beginning of the webinar. You cannot overdose and die on cannabis. If you took a little too much of your nighttime THC oil and a few hours later you were feeling impaired, get in contact with a friend or family member, talk it out. Sometimes when we feel not in control of our body, we can tend to panic. So use some breath work or some meditation just to calm that central nerve system down, and then just distract yourself with a movie or some music. This too shall pass. But if you feel like you need to go and get checked out from the ER, by all means, don't hesitate, but have a family or friend member drive you there, or an ambulance come pick you up. And then for future dosing, you're always going to reduce the dose to the dose that didn't cause that. You may want to discuss changing the route of administration with your cannabis doctor, or they may consider changing the strain altogether, but they should be able to help you walk you through that. And then cannabis safety considerations. So just like any other pharmaceutical or supplement, very important to know how to read your labels. All the cannabis products look the same, and they're only identified by very small writing. So you're going to want to identify your strain type. Is it an indica? Is it a sativa? As well as your CBD or THC content. Is it a CBD oil? Is it a nighttime THC oil? Once you have identified those, we recommend you take a big Jiffy marker, put a D for day, an N for night, so you do not get the bottles mixed up. And of course, all Health Canada regulated product will come with the red THC warning label, as well as the duty and tax sticker from your province. Storing your cannabis is very easy. You want to keep everything in its original containers, keep it in a cool, dark place. I always say alongside your other supplements and pharmaceuticals so that you remember to add it into your daytime routine. If you are using dried flower, do not take your sativa and indica and put it in one jar to save space. You won't know what strain to use at what time of day. But the most important thing is storing all your cannabis out of sight, out of mind, out of reach of both children and pets. If you need to, go to Staples and buy a nice locked box. So just to do a quick overview on dosing for ingestion, if you're a new patient, it is recommended that you start a THC product with 2.5 milligrams of THC or less. In clinic, we will start new patients at around 1 to 1.5 milligrams of THC. So you want to exercise caution if you are ingesting any THC product that contains 2.5 to 10 milligrams of THC, and exercise the most caution if you're ingesting anything 10 milligrams of THC or more. And then for dried flower or inhalation, if you're new to inhalation, we would recommend that you look for a product with 10% THC or less, but with equal parts CBD or higher CBD. CBD is not intoxicating, and it actually may help reduce some of the effects of the THC. And then we want to use caution when inhaling any THC between 10% and 20%, and use extreme caution if you're inhaling any THC over 20%. Remember, start low, go slow. So driving considerations, this is for THC, not CBD. It is recommended that we avoid driving 4 hours after inhalation, 6 hours after oral ingestion, or 8 hours after you feel euphoric or high or impaired. So unfortunately, we know that cannabis intoxication increases the risk of collision by 18%. So we are not telling patients you cannot drive on THC. What we're asking is you take the same judgment and caution you would if you were prescribed an opiate, a muscle relaxant, or maybe you stop for dinner and a wine with some friends on the way home from work. Bottom line, if you feel impaired, you do not get in a car and drive, nor do you go to a safety sensitive job. So traveling in Canada with your cannabis, very easy. You can take it on the plane, train, automobile. You'll receive a registration form along with your medication. However, if we are leaving Canada, it doesn't matter if you're just crossing the border into the US or you're going somewhere, more exotic out of the country. We are not to take any form of cannabis with us, and that includes topicals as well. It is still considered drug trafficking. However, if you are in need of an international travel plan, Greenleaf can help you with that. And so you're more than welcome to reach out or have your physician reach out to us for support in that. And so now that we've learned all this great things on cannabis, why would we choose medical cannabis over recreational? Well, the very first and most important reason is that you have ongoing care and cannabis support by your physician. You're also getting a customized treatment plan, and you have the support of someone who can work with you to adjust it as you go through your treatment. We also have a federal program. As Fonda mentioned, we have hundreds of licensed producers throughout Canada. And as a medical patient, you are allowed to order from any one of those. The licensed sellers or licensed producer offer support programs for lower income patients, as well as patients on disability. And then, of course, all your cannabis receipts can be filed under your medical expenses on your your taxes. And then if you do have extended insurance, such as Sun Life, Manulife, Blue Cross, a lot of them have started covering the cost of medicinal cannabis as well. So you would want to contact them regarding your policy. And so how you obtain an authorization from your healthcare practitioner, the first thing to do would be to book an appointment with either your doctor or your nurse practitioner and have an open conversation on how you feel the benefits of cannabis could help with your symptoms. Together, you'll go over some licensed producer options and some recommended products, which then you will go ahead and register on their website. The doctor or nurse practitioner will fill out the medical document and fax it to the producer on your behalf. And about 3 days later, you'll be able to order, and then you'll follow your customized treatment plan. And you should be following up within 6 weeks just for a checkup. However, some physicians may not want to prescribe the cannabis, so they may actually refer you to a specialized cannabis clinic like ours.
Thank you, Tanya. That was very well done. Really what we were trying to understand is, you came into this webinar with a certain amount of knowledge about cannabis-based medicines. Has your knowledge improved? So maybe you can just let us know, yes, no, this webinar was great. Please tell us that. And then we'll get into our live Q&A. So yeah, ask us anything. We're here to answer questions. If there's nothing that we can't answer, or if there's something that we can't answer, we'll make sure that we get the answer for you.
I have a question though for you. You talk about when someone is on medical cannabis of whatever form that may be, and traveling within Canada is fairly easy, but traveling outside of Canada not to take their medications for obvious reasons. Is there any type of withdrawal? Is there a concern of withdrawal if they are saying, okay, I'm going to Europe, or I'm going down south for a week, I can't bring this with me? What would their concerns be around that?
Good question.
Yeah, so they could experience, light agitation. They might have a little bit of a headache. They may feel a little bit more fatigued. Typically, CBD is not addictive. So if they're on CBD alone, it most likely they would have to possibly go on to their other pharmaceutical. Or the other thing that they could do while they travel is they could get their doctor to authorize them the synthetic THC that has the DIN number. So Nabilone, for example. There's also Sativex, which is an oral mucosal spray of THC to CBD. It's not legal in all countries. So we'd have to look at those countries. And I would say a lot of countries now do have legalized cannabis. So you can buy CBD, for example, and THC also abroad. But if you're completely stopping your cannabis products, then yes, you would have a little bit of anxiety, possibly headache, maybe not sleeping well, but that would go away. And patients find too that if they do stop, and then they come back on it, like when they stop it, they're like, wow, like I can't believe how much this actually working for me.
Yes, I was just going to say that. Fonda's 100%. Most of the feedback we get when they come back from travel or pre-COVID, we had a lot of patients that would live, in Mexico for half the year or whatnot. And they always come back saying, oh my gosh, I just didn't know how well it was working until I stopped. And so they're very excited to get right back on there.
Withdrawal symptoms might be irritability, anxiety, a little bit of sleeping, some headaches, maybe a little bit of restlessness. But usually those are very short lasting. And then the thing with CBD is CBD has not been associated with any dependence or really even abuse. When it comes to cannabis addiction, that's more in the adult recreational market where they're using higher amounts of THC.
Which is another good reason for folks to, if they're wanting to explore this as a treatment option, to always speak to their healthcare team and follow the right process in which to use this, so it best assists in their healthcare, overall healthcare, and especially if they're going to have to stop it at some point in time. I think, would there be like with some other medications where they wean themselves off of it? Would that be something that might be recommended or no?
Yeah, we don't find that in clinic. Usually if they stop it, it's great to stop it because you can also do what we call a washout. So a washout is where you reset your cannabis receptors. So a washout usually takes about 3 weeks where you're not using any THC. So caution though, so if you are going outside of the country and you're currently using THC and you don't have access to THC, when you come back to Canada, don't start out at the same dose that you were on previously, because by stopping THC, you're resetting your cannabis receptors. And so you would start out at a lower dose.
Right.
To make sure that you don't experience those side effects, because with THC especially, we do really slow titration. As Tanya said, we start patients anywhere from 1 to 1.5 milligrams. CBD is a little more forgiving, where we'll start patients at about 5 milligrams twice a day.
Yeah. Okay. So I know you referred to it in one of your slides, sort of the process if someone wanted to explore this as a treatment option, the steps in which they need to go through. So for folks that are maybe having those questions, this will be recorded. So you'll be able to go back and look on those slides as to, if I'm thinking about this as a possible treatment option for myself, you can look at that slide and it'll show you and illustrate to you, how you can go about that process. But first and foremost, always talk to your primary care physician about any form of treatment that you may be looking at incorporating into your healthcare plan.
100%.
And quite often physicians are not against authorizing cannabis, but there's a lot of nuances to prescribing it. So they may feel like, yeah, you may actually benefit, but I don't know how to authorize it. So if that's the case, then your doctor can also refer you to the Greenleaf Medical Clinic, where you can be assessed by one of our physicians.
If folks do have questions, please send them to info@lupuscanada.org, and we'll do our best to answer those. And then we would probably refer to Fonda or Tanya to address those more specifically, because we have limited knowledge in this area.
And they're more than welcome. The great thing about Greenleaf is we do offer a lot of educational cannabis webinars. So you don't have to be a patient of ours. You can jump on one of our webinars, ask as many questions as you have at the Q&A with our physician, or feel free just to call us. If you have a question or concern, we will direct you in the right avenue. So yeah, just reach out.
It seems that the chat is disabled. I'm not sure why. So we're obviously having some issues with our chat box. So we apologize to everybody about that, because that's probably we're asking a question, but we can't hear you. So please send those questions to us at info@lupuscanada.org, and we will definitely address those. We apologize.
Well, I think you're just going to have us back.
Yeah,
that's what I was going to say. We'll see you back in a month.
But I just want to share this, then if you have other questions, you can attend. So Dr. McCallum's amazing. And she sits with Tanya and I on our webinars every Wednesday. So we do the Cannabis 101, which is more in depth of what you learned today. You wouldn't necessarily want to do the follow-up group, but there's the Cannabis 101, which is great. Then we have the inhaled cannabis, and as well as one on edibles. So you can just go and register on our website, and then you don't have to be a patient. These are free, but you'll have access to Dr. McCallum also, who can answer any question you may have. And she's absolutely amazing. You guys would just totally love her.
Yeah. Do you want to just give them a briefing of who Dr. McCallum is and what she does?
Sure. Yeah. So Dr. McCallum is the Greenleaf Medical Director, and prior to being a physician, she was also a pharmacist. She's an internal medicine specialist. She trains all of the Greenleaf doctors, as well as works with Tanya and I on educational content. She's what I would consider as well as a KOL, which is a key opinion leader on cannabis. She's written several scholarly publications, authored several chapters in books, and continuously learning, just like we are, on cannabinoids in clinical practice. We're seriously learning like every day.
Yeah.
Yeah, I attended one of their sessions and I found it extremely informative. So as I mentioned, you can always look at their different webinars if you want additional information about any of the topics that we've just discussed today or more.
Trying to
Excellent.
avoid the sun in my room. Okay,
Wonderful.
perfect. Well,
Thank you so much.
You. We just want to, well, I would just like to say it was an honor to be asked and to present today for the Lupus Association of Canada. So thank you for choosing us. And I also want to my sensei, Fonda, who was actually invited and she just snuck me in. Thank you for having the confidence to bring me with you.
always, Tanya, always. You guys don't know this, but we always pray. So
Yeah, we always pray.
we were so nervous. We're like, okay, we have to pray to Jesus.
Well, it was wonderful. Thank you so much to both of you for this valuable information. I'm sure folks got lots of, probably going to get inundated with lots of questions, which is fantastic. But as we said, it's recorded. This will be available on our website within about 24 hours. So folks can always visit our website for this recording if they want to revisit and learn a little bit more. I know there was lots and lots of information there that we all had to digest. So thank you again, Tanya. Thank you, Fonda. Thank you, Ariana, for moderating. And I hope everyone has a wonderful, wonderful evening.
Bye.
Thank you.
Thank you. Good night.
Bye-bye.